Bismillah. So let's talk about the skull, right? So when we're looking at the skull, we do not study the skull as a single bone, but we study it in terms of views, lateral view, frontal view, like that. Okay, and we will study it together. So we break down the skull into two parts. We break it down into the calvaria, which is the skull vault, right? And we have the facial bones. Now let's talk about the bones of the calvaria. So what are the bones? We have the frontal bone, we have the coronal suture, we have the parietal bones, we have the sagittal suture, and then we have the occipital bone over here, and we have the lambdoid suture. So we can see them better in here: frontal bone, parietal bone, occipital bone, and lambdoid sutures. So wherever these bones they come and join together, we have fontanelles. So here, this part where the parietal bone joins with the frontal bone, it's known as bregma. So this part is the frontal fontanelle. It's a membranous gap between the bones. It allows the growth of the brain. So if we can feel it over here, we can feel the pulsations over there. So it is this anterior fontanelle. It is fused at around 18 months after birth. Now we have the lambda over here, which is the posterior fontanelle. Okay, now the posterior fontanelle, it fuses at around 2 to 3 months. Then we have the temporal bone, which is the yellow bone, temporal bone, and we have the sphenoid bone, which is the blue one. This blue one is this sphenoid bone. Okay, now let's look at the muscles of the bones of the face. Here we'll be missing one muscle, one bone. So this the red one is the sphenoid bone, and the one without the color, it is the ethmoid bone. Now looking at the bones of the face, right? We have the nasal bones, the white ones. We have the maxilla, which is the green one, this section. Then we'll have three transverse lines in the nasal area. So the first is superior nasal concha, middle nasal concha, and inferior nasal concha. The inferior nasal concha is a separate bone. Then we have the palatine bone. We have the palatine bone, which forms the hard palate, and then we have the mandible, which is not over here. The mandible attaches over here in the mandibular fossa over here, which is a little ahead of the external acoustic meatus. There is the mandibular fossa where the mandible attaches. If you look over here, so there are two fossas over here. Lacrimal fossa on the side of the nasal bone. There is a lacrimal fossa. So this is where the lacrimal ducts are located, and this is the lacrimal bone. Yeah, and that are seen from the view above, like this. So what are the structures that can see from the view above? So we will see the frontal bone, the parietal bones, the occipital bone. We will see the coronal suture, the sagittal suture, and a little part of the lambdoid suture. So the bregma, we'll see the lambda, anterior and the posterior fontanelles, and we'll see the parietal protuberances on the two sides. The parietal protuberances are actually the elevations on the parietal bones, which are the most common site of injury if in road traffic accidents, right? Then we see the parietal foramina, which are two foramina on 4 cm above the lambda, 4 cm above the lambda. On two sides of the parietal protuberances, we have the parietal foramina, through which emissary veins they connect the external the emissary veins connect the which are valvulus veins, which connect the external part of the skull to the internal part of the skull. These veins, they will go to the dorsal venous sinuses on the internal part and connects with them. So blood from the outside can move to the inside, and from the inside can move to the outside depending on the pressure. Now the significance of this is that if there is an infection on the inside, then it will come to the outside. Similarly, if there is an infection on the outside of the scalp and they move to the inside of the skull to the brains, then there we have some problem. So that's why it's really important. We have on the inside of the skull, we have the superior sagittal sinus, the superior sagittal sinus, where when we have the brain inside, when